Inside this teaching museum, the devastating impact of syphilis on the body has been preserved.
The skull that we have here in our museum is of a person who suffered syphilis for a number of years, and you can see pits in the bone of the skull.
This 19th century skull from Adelaide is an extreme case, but a resurgence of the infection has experts worried the worst of syphilis may not be confined to history.
It's 100% important not to allow it to spread and to become endemic.
The corkscrew-shaped bacterium that causes the disease can pass the skin barrier in sexual contact and in utero. 42 baby deaths were reported between 2015 and 2025. More than half were First Nations babies.
And it is entirely preventable. So even if a pregnant person, if the mum has got syphilis, we can totally treat the pregnant person, and then the baby will not be at risk any longer.
The outbreak is being felt acutely in the NT, where the syphilis numbers are more than 7 times the national rate.
The case burden is in remote Aboriginal communities, and the difficulty there is really about access.
We really need to promote the awareness of syphilis and how complex the syphilis is.
This is the Iceland LA.
Rolling workshops are being held to raise awareness and stem the spread. Patricia Nandrabala has travelled from southeast Arnhem Land to workshop ways to test, treat and translate the complex infection.
I sometimes get very emotional giving them 2 injections because it's painful for them. But I always do give them the right story and tell them that it's a treatment that it'll help you.
Early signs are easy to miss. If left untreated, it can turn deadly.
That can happen like 5 to 30 years later. So you could just have it there just running amok, and that can affect all organs. So it can affect the brain and cause strokes, it can affect the heart and heart attacks.
Modelling shows syphilis cases can be controlled if testing rates can reach between 70 and 80%. NT health officials are calling for a $30 million funding injection from the federal government to get the job done.
We will drive down the case numbers, and we will have success because we have the buy-in of community and we have the buy-in of all of our service providers.
The strong message to all Australians is get tested.
Don't be ashamed, go and get tested. It's an easy fix and it could save you a lot of trouble down the line.
A call to action that could save lives. Laetitia Lemke, ABC News.